pressure to soften sentences for drug dealers. Now authorities are worrying about a sinister new possibility after yesterday's mass overdose in a New Haven park.
When you affect such a large population, who's to say they weren't really trying to harm people intentionally?
Former DEA Special Agent Derek Maltz is here straight ahead to answer those questions and more about this terrible epidemic.
I'd also like to ask you to bring a major lawsuit against the drug companies on opioids. Some states have done it, but I'd like a lawsuit to be brought against these companies that are really sending opioids at a level that it shouldn't be happening.
Now, it's not the only issue. Some highlights there from the president's cabinet meeting telling his attorney general to go after opioid makers and manufacturers. Now, the overdoses that you saw in New Haven, that wasn't about opioids, but the powerful pictures served as a pointed reminder of the overall drug crisis sweeping the nation. Former DEA agent in charge of special operations, Derek Maltz, is here to weigh in. And Derek, it's great to have you back. You have looked at numerous connections about the drug trade. There's some very troubling things that go overseas. What are we looking at now?
We're looking at millions of dollars leaving the United States from gas stations, bodegas, convenience stores, going back to Yemen. Yemen is a country that's really a very poor country, and we have some radical people that are basically starting fundraising drives around the world looking for, funding. I mean, crime is generating so much money. These terrorist groups need money to operate.
And I know that you've looked at the links between narco-terrorism and the fact that there are people who say sending this garbage into the U.S. where they know there's a problem is actually a form of, quote, jihad against the U.S.
It's a jihad against the West, and it's also a 2-for-1 special. If I'm a bad guy and I can make multi-hundreds of millions of dollars and kill Americans and destroy families, that's a big win for us as a bad guy.
Yeah, the Washington Post, looking at these new CDC numbers, have this to say: drug overdose deaths surpassed 72,000 people in 2017. That's according to provisional estimates recently released by the National Centers for Disease Control and Prevention. That represents an increase of more than 6,000 deaths, or 9.5% over the estimate for the previous year. This doesn't show signs of abating. It is truly a national emergency.
This is not only a national health emergency, it also has serious national security implications. When you're talking about bodegas and convenience stores involved with EBT fraud, ripping off our welfare system, counterfeit goods, drug paraphernalia, all kinds of crimes, and it's sending millions of dollars back to Yemen to support radical terrorists, that's a serious thing. And then to have families destroyed around America, dropping like zombies, it's like scenes of the Night of the Living Dead. Like New Haven today in the park, a block away from the DEA office. We have kids like falling down, homeless.
Stunning.
They're marketing this to the homeless because it's so cheap. And it's like they're putting poison in this stuff. And then you start asking yourself, why did we have all the deaths in Chicago? In our nation's capital, 300 people. Then the first responders now are tied up, picking up these zombies, bringing them to the hospitals. Then our doctors, our nurses, all our services are consumed, our firefighters, right? If you saw the news in D.C., our nation's capital, just last month, you had like fire departments and police everywhere, emergency warnings. The FDA just put out a warning on the blood supply because anybody that's smoking is poison. And by the way, it's not synthetic marijuana, it's poison from China. And that's another part of the story that people need to be aware of. This is almost like chemical warfare against America because they're putting fentanyl all over our country and they're putting this poisonous compound, spraying it on leaf material, and giving it to our kids and our communities.
I mean, it's beyond just the normal dangers, which are already so dramatically negative with drugs when you're looking at people and risking their lives for something they think maybe is recreational. Derek, thank you for always making the connections for us, and I hope you'll come back soon because this, unfortunately, I'm afraid is not going away.
Thank you very much, Shannon.
All right, tonight's